Okay, good afternoon, all. Thank you so much for joining us here this Monday for our SAME Health Engineering Task Force webinar. Today's topic is the Built Environment and Mental Health webinar put on by Lieutenant Colonel Andy Hoisington out at Tyndall. So what I'm going to do now is I'd like to start off. You see our videos here. And I'd like to start off by introducing Lieutenant Colonel Andy Hoisington. So thank you once again, everyone, for joining us today. Okay, please stand by. And whoever's in the audience, I would like you to come and join us by chatting, letting us know you are there. So feel free to comment at any time, ask your questions at this time. Let us know, let Lieutenant Colonel Hoisington and I know that you're out there in the audience. You can ask your questions at any time. We'll be sure to get back with you towards the end of the webinar today. So once again, thank you. So I'd like to start off with reading. What I'd like to do is read Lieutenant Colonel Hoisington's bio. I really don't want to miss out on any of the details. He is an expert in the topic. I'm very, very happy to work this with him and present it to you today. And so without further ado, here is Lieutenant Colonel Hoisington. He has 20 years of active duty Air Force experience in civil engineering and education. He was awarded his bachelor's degree from the University of Michigan and his master's and doctorate from the University of Texas. As an Air Force civil engineer, Lieutenant Colonel Hoisington has managed over $400 million in construction projects and led 2 flights. He has 3 short tours and 2 deployments under his belt. Lieutenant Colonel Hoisington is currently the Tyndall Program Management Office Executive Division Chief, where he is responsible for a 25-person team and $2.8 billion in construction at Tyndall Air Force Base after the devastation left from Hurricane Michael in 2018. Lieutenant Colonel Hoisington is an adjunct associate professor at the Air Force Institute of Technology, that's AFIT, out at Wright-Patterson Air Force Base, Ohio. He taught and directed the master's program there for 3 years. Prior to that, he was an assistant professor at the U.S. Air Force Academy for 6 years. His dedication to education and his students earned him the SAME National Educator of the Year Award, the U.S. Air Force Academy Outstanding Academy Educator Award, and the MOAA Military Outstanding Instructor Award. Lieutenant Colonel Hoisington's primary research focus is studying the built environment to improve occupants' health. Specifically, his work has investigated building factors that correspond with negative mental health outcomes. Lieutenant Colonel Hoisington is a primary microbiome analyst for a $1.9 million National Institutes of Mental Health, the first government-funded study on probiotics and mental health. To date, Lieutenant Colonel Hoisington has 21 peer-reviewed journal articles, 1 book chapter, 5 conference publications, 6 distinguished lectures, and 64 non-peer-reviewed articles. Google Scholar notes his peer review work has 347 citations, and he has H-index of 10. As a founding member of the Department of Veterans Affairs Military Veterans Microbiome Consortium for Research and Education, Lieutenant Colonel Hoisington has served roles in the Air Force Research Lab 2030 Research Initiative, Department of Defense Tri-Service Microbiome Consortium, the 88th Air Base Wing Institutional Biosafety Committee, and AFIT Facility Research Council. So in addition to AFIT, Lieutenant Colonel Hoisington holds appointments with the University of Colorado Anschutz Medical Center and the Department of Physical and Medicine and Rehabilitation and the Veteran Affairs Rocky Mountain Mental Illness Research Evaluation and Clinical Care. So without further ado, I would like to turn it over to Lieutenant Colonel and Dr. Andy Hoisington. Thank you so much for being here with us and for presenting to SAME today. Thank you.
Thanks, Lieutenant Graham. Appreciate it. So thanks, and thanks everybody for tuning in. And we're going to talk a little bit today about mental health and the built environment. Before I get there, let me just do our first poll question. And so we will have several poll questions here throughout the hour or so that we're together. And I'd like to get some feedback. So if you're not familiar with how SAME does this, if you can go to the polls and enter in your information. I think we have 4 or 5 polls kind of as we go forward. I'll try to adjust kind of on the fly, which is quite a popular now in the teaching mechanism, but we'll see how I do. So thanks for that. And so, as mentioned, today we're going to talk about the built environment and mental health, at least where it's at right now. And where I got my start with this, I was talking to a counselor that was doing research in Denver, and she was saying that after suicides, they had a new program where they were going into individuals' homes. So people had suicide attempts, and normally the follow-up is phone calls, but they were going into people's homes. And I said, oh, that's awesome. Are you giving them some tips on what they can do in their built environment to make it less likely or reduce their chances for future suicide suicide outcomes? And she said, well, I'd be happy to include that with my counselors, and we can put a flyer together. And so that was 7 years ago that I thought I would just take a weekend and put together a flyer. And I found out when I started looking through literature that there really is not as much information as I would like to see in this. So I was not able to put together a flyer, and still 7 years later, I'm going to cover kind of this journey that I've been on and where we're at with it and where I understand literature is at with it, mostly from the academic sense. But I'll cover also, I understand the practitioners are here, so I'll cover some of that as well. So disclaimer, I am sitting in my house with due to COVID restrictions, but in my uniform, but this is Andy Hoisington talking. This is not representative of the Air Force, Department of Defense, or any other government agency. So as I mentioned, we started this MVM Core, so Military and Veterans Microbiome Consortium for Research and Education. I was one of the 4 founding members as when I was at the Air Force Academy. And basically what we did is we said, well, we'd like to know more about the military and microbiome. And to do that, like, how do you get started with that kind of research? And we thought, well, we'll just start with a name. And since we're in military and or veterans, we thought, well, we better get an acronym, a fun acronym for that too. So we did that, and that's where we started 8 years ago. And one of the things that's allowed me to do with that team, although this focuses on microbiome with the team, but it also gives me access to the VA and their psychological research. And so I've been able to kind of use that to my advantage, and I'll talk about here. If you want to follow us, you can follow us, and Twitter is probably the most updated. So this is acknowledgement slides. I think I like these to come first so people see who else has helped out with this work. The top 3 there, as I mentioned, there's 4 of us that started MVM Core. Top 3, Dr. Brenner, Dr. Postolache, and Dr. Lowry are all part of the founding members there. Dr. Brenner and Dr. Lowry are really kind of run the day-to-day for MVM Core. I also wanted to acknowledge 4 of my students that had a master's programs where I'm going to talk about some of their research that they did. Captain Beamer, Captain Cole, Captain Taylor, and Captain Yip. I also, these slides are all available to you all, so I wanted to kind of, you'll see in the slides, I put a lot of my reference in there. So the idea here is that I'm starting a conversation that will continue. And so one of the things we do, part of our aim with MVM Core, is that research and education, and the education piece is important to us. So I highlighted kind of the top 10 mental health research papers that we put out. And these are all publicly available, so you can Google those in your spare time if you wanted to read up more. I highlighted 2, so we also contributed to SAME's The Military Engineer a couple of times, and we have another paper that we're working in review in relation to this topic. So here's another poll question, our second one, I guess, right? So it looks at, I'm asking, how much reading have you done on mental health in the built environment? Right? And so if you give me an opportunity, and again, you can go to the poll questions and kind of click off to the right. Some of that, like I said, I'll use to kind of tailor this presentation, but others we can use it also for the questions. I'm kind of interested in how many times folks have already read about this, right? So with that kind of introduction and background, let me actually get into what I wanted to start talking about. So, which is the built environment. And this is an example in St. Peter's Basilica in Rome. Right? And this is something that that inspires many folks who go to visit. It kind of has a sense of awe with the grandeur of this facility. You can fit many football fields in there with the lights and the ornate decorations. And we also can see other things like the Eiffel Tower, Gustav Eiffel's tower, which was built in 1889 for the World, 1889 for the World Fair, and initially supposed to be temporary, but of course it's now a lasting symbol in the built environment, right? And these again has an emotional response. We can actually look a little closer than overseas, and if you've had the fortunate opportunity in the last 7 or 8 years to go to the Air Force Academy, you might recognize this facility. This is the Center for Character and Leadership Development, intentionally designed with a very large, open, airy structure and panels that point up to the North Star. So to indicate to our students, mostly, or anybody that's there, that we are held to and we should go by a non-changing direction that provides kind of our foundation, and it's a very inspiring place. And more particular to this talk, this is St. Elizabeth's Hospital, which is outside of Washington, D.C. I was fortunate to go give a talk there a couple of years ago, which is really kind of neat. So this is the first federal mental health institute in the United States. This picture actually from 1890. And here they start recognizing things. In this case, this is an enclosed porch. And they started putting beds out there for mental health patients. And so you can also see plants as well placed out there, right? So starting to recognize the idea of mental health, how it ties into the built environment. And this is one of the earlier examples that I have, at least in the United States. And some of the same principles are still now used. And actually, most of the research in terms of mental health in the built environment, if you actually do the literature reviews, you'll find yourself kind of swamped into this area of research that has to do with mental health facilities, not necessarily where we spend nearly 90% of our time, which is in the built environment, like our buildings or offices. And I'll give just a brief introduction here on why at least I care about the mental health, right? When I talk about mental health burden, you start seeing some big numbers. 45 million Americans have a diagnosable mental health disorder in the last year. 10 million of those Americans actually have functional impairment. They limit what they can do in their day-to-day lives because of this. I just put 2 kids out of the house. So this 13 to 18 age range, that kind of worries me. 21% have some kind of mental health disorder, have or had. And if you start thinking about, well, what kind of other research are we doing with teenagers? And we see a lot in terms of like asthma. Asthma in that same rate is 8.2%. And we also see some in diabetes research. Diabetes in that age range is about 0.2%. And so kind of big numbers. And then the last number there I'm showing is just the suicide rates. Unfortunately, that's been about the same over the years. Anywhere between the 30 to 50,000 Americans commit suicide each year. That is higher than deaths that are associated with breast cancer, leukemia, or even transportation. So you're more likely someone is more likely to die in a suicide than they are in a car accident, unfortunately. It's also twice as the number that we have in the United States of homicides. And this is not just a US issue. We can go across and see when we look at the UN's daily adjustable life years, we see it's number 3 in the chart, only behind basically infectious diseases and heart disease. So it affects a lot of people. And so I think that's one of the reasons that we're looking at it. And it's not just people in general. We also see that military are actually more prone to mental health, negative mental health outcomes. They're 2 times more likely to experience negative mental health outcomes. So about 30% of service members have some negative mental health outcomes. PTSD is quite often talked about, and we do have some very high, about twice the rates of PTSD compared to the US average. And then we have suicides, which is also discussed quite a bit. Veteran suicides 2 times the national average. And the other one that we think about, at least in terms of our research, is traumatic brain injury. Right? And so if the average US population is 2% traumatic brain injury, and military that come back from deployments are anywhere from 11 to 23% traumatic brain injury. And there's a lot of research, including our own, that's linking traumatic brain injury to mental health outcomes, especially with immunoregulation. So this is something that we're kind of working through and thinking through quite often now. And now in this presentation, I kind of will lump mental health disorders. Sometimes I'll talk specifically when the research is specific, but I did want to recognize that mental health disorders are quite varied. And so when I say mental health disorders, I'm talking about one of 157 diagnosable mental health disorders. That in this case is what the American Psychiatric Association uses to diagnose this DSM-5, which is a quite thick book. And there's some examples there. So just recognizing that that I'm kind of grouping things together, but I do know that that somebody who has anxiety issues is very different than somebody maybe who has mood issues. And the way I'm going to set this up, I kind of chose some that I thought were important, and these are the 6. And so I'll kind of go through each of these topics: air quality, lighting, personal control. A brief thing on microbiome, since I do a lot of microbiome research, I couldn't resist at least putting one slide in there. And then I'll talk about green space and social economic status, and recognizing that SAME is a lot of practitioners, and I'm looking through the names that I have here that are on, and I haven't seen the poll yet. Let me look back here at the poll. Right, so I see government, I see small business, medium business, I see no academics so far. Right, so one of the things I wanted to do is to actually kind of help out with what do we know now, and what actions would I think we could do right now. And so that's what that gray box will be as we get to these different sections. So another poll question here, and it doesn't have a right answer. I'll give you that hint right away. And so, but I'm wondering, what do you think out of these that I'm going to present are the most important parameter for mental health in the built environment? So I'm going to present, talk about, well, I didn't include indoor air quality in general, but more specifically VOCs or mold or PM or allergens or some others. I just wanted to get an idea where you all are at and what you're thinking there. I also would say thank you for the input on the first or second poll question about the reading. So as we go through this, you'll see that I cite many different articles, including the ones that we published. So I encourage you to read more. It looks like all of the group is 3 articles or less on mental health in the built environment. So overall, we did a study back in 2019 where we said, let's look at all the research that's out there and see what's happening with air quality and negative mental health outcomes. Here, we're showing this based on odds ratio. And so if you're not familiar with odds ratio over 1 indicates a positive relationship between a pollutant of interest and a negative mental health outcome. And pollutants here, it doesn't probably take you too long to look through and say, well, these are pollutants that are very common to Clean Air Act. And these are mostly outdoor pollutants. And so you're right? So a lot of this early work, or I don't want to say early, but a lot of the work in the last decade in relation to air quality and mental health has to do with basically large cohort studies where they can gather information from a community, and then they can relate that to measures of outdoor air quality, right? And so that's why they have this PM 2.5 or PM particulate matter 10. If you're not familiar, that's 10 microns or less. PM 2.5 is 2.5 microns or less. And the studies are not standardized as they go, and I have some notes there. Sometimes they look at pollutants and then say, well, 3 days later, what happens? Sometimes 2 days later, sometimes a week later, so some kind of lag. Sometimes it's on the same day. And so there's some non-standardization there. And of course, as we read through all of this stuff, correlation should not be mistaken for causation. But nevertheless, the outdoor air studies probably are a good initial starting point. And we as our group in MVM Core focus a lot, as already mentioned, on chronic low-grade inflammation that can be influenced by air pollution. And the biological mechanisms underlining the link between inflammation and stress-related psychiatric disorders has been extensively studied. So basically, it's saying, if our body has a reaction to this and it causes some kind of inflammation, that we already know that inflammation is very much linked to mental health disorders. So that's kind of the avenue that we've been looking for in terms of biological mechanisms. But as mentioned, if we look at overall area, and in this case, this is if some of y'all might be familiar, this is California, and a bit more specifically San Francisco, where they Joshua Apps did an interesting study looking at black carbon, which is similar to PM. And so here you see, basically, you can see where the busy areas are, black carbon coming from automobile emissions. And so we see, like, depending on where you're at, you could have a very different outdoor input of indoor air quality. So as we look at these studies that take these geographic areas and correlate it, it's probably not completely accurate. And so I think we do need a little bit more fidelity as we go forward with indoor air quality research and mental health. And there's lots of equipment that now is actually getting quite inexpensive that we can measure indoor air quality equipment. I'm sure a number of you have seen these types of equipments, whether it's measuring particulate matter, temperature, carbon dioxide, VOCs. There's lots of different measurements. We won't go into, and we can in questions about how accurate they are and how much and other issues with them, and that's fine. I'm happy to talk about that. But my point here is when we actually deal with people with mental health outcomes, and especially ones that are severe, depression or schizophrenia or something like that, they actually don't really like to put anything in their houses. So it becomes like an additional challenge. You're not dealing with participants that would give you free access, right? So they don't like researchers coming in their house. They don't like having these kind of things placed in their house, which is causes some pause in certain cases. Now, let me get into another specific item of interest, which is this idea of volatile organic compounds. And VOCs actually originate mostly in the indoors. And so when we talk about the difference between air quality or other things, it's important to think about what happens or what occurs as a source in the indoor environment and what is on the outdoors. So the particulates, for example, is outdoor mostly source, has some indoor sources. VOCs is mostly an indoor source. And so that's has historically been smoking was quite a large source there, and then also furniture. So off-gassing of formaldehyde and other things, and paint, which has been reduced. Cleaning products are still a big one. Air fresheners, every time you spray your Glade air freshener, you have something there. And then cooking is another big one. And so there's several studies that kind of look at this in terms of VOCs and which each of these things contribute. And then I go ahead and I break down the different health effects, and I highlight different studies that are associated with them. And you see that most of them are the major ones that I'm citing here are quite old, certainly in terms of the mental health, which are the bottom ones there, depression and anxiety. So not tons of research that's happened with VOCs. However, we do think about this in terms of a mechanism, and think it probably is quite important, mostly through microglia priming. So in the context of neuroinflammation, priming is when a previous condition or prior exposure to a stimulus potentiates the immune response to sequential conditions. So VOCs, for example, can activate the brain microglia and include that microglia priming. And so basically what that's saying is, our brains can recognize and has an immune response to VOCs as it gets into our body, whether that's through our bloodstream or other mechanisms, right? And so it can have some kind of immune response. And those kind of immune responses, or the microglia priming, has been linked to anxiety-like behavior and cognitive impairment. So processes that are both exacerbated by stress and by aging. So as you see you'll see this a number of times, like what we've done so far is we've taken the research that's out there associated with a potential mental health outcome and the mechanism, and said, well, if it causes this mechanism, and then we see if that mechanism also is related to a mental health outcome, which is a lot of what we've been working on to kind of figure out where we want to focus. Another one, as we look through air quality and we think about this, is mold. And so living in Florida now for the last year and a half, I've been thinking more about mold in a very high humidity environment. And so mold comes in through either water damage, it could also be condensation. And it's generally thought, and there's been a number of work that's been done through allergic response infections or other things. In context of mental health, though, we look at different things, and most of the work here on mold right now in terms of mental health has been done in animal models. And so this is what I'm showing you in the right there is a mouse model. And so if you're not familiar, that's called the cross arm, or the X. And so what they do is they put a mouse in there, and generally mice are kind of fearful creatures, and so they'll hang out in the dark, and then they put some food out on the open arms, and then they'll come out a little bit. And so what that B is showing you, one is the vehicle, and the second one there, and this is number 7, that's how much time the mice spent outside that open arm when they were exposed to mold spores. And so if we look at that, that kind of, well, first off, I should back up. So if they don't come out to the open, then that's kind of an anxiety-like behavior. They're extra concerned. And so in a mouse model, we can see that mice that are exposed to mold could have more of an inflammatory response and more anxiety-like response. And there's been a couple of other studies on depression and PTSD. Mostly those are related to self-questionnaires. The other one, which is probably the most studied in terms of mental health in the built environment, is this idea of particulate matter, right? And I mentioned that there is some sources outdoors, certainly in the urban environment, or if you're in a very dusty rural environment. But you also have the indoor sources like smoking, cooking, cleaning, that can occur indoors. And like I said, there's been several studies. Most of these are kind of large studies that went through, but one of the ones I found, which is actually a human study, looked at candles. And so they lit a bunch of candles, which has a particulate level, and then they measured the particulate level. And those individuals were exposed to over 25 micrograms per meter cube, which is the World Health Organization, kind of their guidelines they set for PM 2.5. They scored worse in cognitive tests. And cognitive function, along with social skills, are components of mental health that impact engagements with basic tasks and social roles. And so that's what that's showing you there. So those that in the blue there that were exposed to higher than 25 micrograms per meter cube scored higher also on their cognitive function, meaning they did worse. And so I had a student, a very smart student, that went through and said, well, how can I develop a model instead of basing everything on the outdoors? I'd like to base things on the indoors. And so we did a mass balance model that he created and looked at different outdoor relationships and then and indoor conditions, right? And so one of the things we were kind of thinking about was, at least in 2019, there was a bunch of wildfires going on. And so we were thinking, oh, well, wildfires is quite a large particulate mass. So we looked at those, and then we looked at a couple of U.S. cities, and then we looked at a cost-benefit rate or benefit-cost ratio, right? And so if it's over 1, then it's valuable to do a certain action. If it's less than 1, then it's probably not valuable. And here we saw and what we were the action that we were hoping for or looking at is actually to go from 0 or no MERV, which is really an unrealistic setting, but to go basically from your standard MERV 4, MERV 5, maybe up to MERV 7. This is how well your filter works in your HVAC unit, to a much larger and more efficient. In this case, we used a MERV 13, which our cutoff was, which is not quite HEPA filter, but most newer systems could handle a MERV 13. And so we looked here, and you can see, I'll just highlight a couple of things, but in general, like if you're sitting in an average US city and you are not especially prone to a mental health outcome, you probably don't have much cost benefit to increase the MERV filter. Now that of course we're only accounting for one outcome, in this case, major depressive disorder. If you think about all the other health impacts of particulate matter, then you might actually go over one. But there are situations in the case of wildfires or in the case of extreme cases, which is actually those are actual numbers from developing countries. They're particulate matter that's located outdoors, where it certainly would be beneficial to have a higher for MERV filter. The other thing we think about, and we've done some research about, is indoor air and allergens. And allergens could be indoor related, indoor source, or it could be external source from the built environment. And the potential for indirect biological mechanisms trigger exacerbation of underlying medical conditions, which generally leads to negative mental health outcomes. Right. So we have, if you think about this in terms of like let's do a pie, right? And so if you think I've already had enough, I've had enough, and then you happen to have the sniffles on top of that because of an allergy, right? That can push people into another level for their mental health. And indeed, when you look at suicide rates, they're the highest in the spring. And there's been a number of research that associates that aggression and mood disorders and suicide rates with allergens. And so we think this is important in the built environment. Now, as mentioned, I wanted to kind of stop at some point and say, hey, well, so what? Like, what do we do about this? And so here's some potential items here. I got an old study, 7-year-old study that looks at HVAC efficiency. And as I already mentioned, I think that's kind of important there. And so we can increase filter efficiency if the source is located indoors or outdoors. Eliminating sources is often a very good opportunity. Sometimes we can do that, sometimes we can't. But we can choose not to burn incense or something, and choose a different way to add a fragrance to our house. We can give the opportunity for occupants to open windows, not something the military or the Department of Defense probably does very well. Most large business, I guess, would be in that category. But that's a good thing to increase ventilation rates. We can think about portable air cleaners in certain situations. And so if you had a very high exterior load of indoor air pollutants like PM, and let's say if you're sitting over in the desert and you have a job that's maybe already pretty stressful, like that might be a great opportunity for portable air cleaners. And there's a lot of research, and we can talk more about clean air delivery rate and other things that make those important. And then lastly, when we talk about especially allergens, you can think about how do we clean and disinfect surfaces, including floors, so we're avoiding resuspension. The other thing another one I wanted to talk about was this idea of light. And light can be maybe the most intuitive, at least from when I talk to people, factor that kind of influences or is associated with the built environment. And so, and you can also, you probably have heard of light therapy to improve mood and reduce depressive symptoms. Indeed, there's been more than 70 different therapeutic trials that demonstrated that bright light therapy could be incorporated in buildings, especially in locations with reduced natural light in parts of the year. So as I sit here in Panama City, Florida, and which is right on the border of Central Time, right? I think about that in terms of my daylight in the winter, when you hit daylight savings, all of a sudden the sun goes down at about 5 o'clock. So is there stuff that we could do in the built environment to alter that and to adjust that? And the thing with light, though, it is a sensitive response. So bright light therapy works best in the first hour you get up from your sleep. It does not work, and it's actually quite negative if it's associated with or brought on later and towards the evening. And there's also been a lot of research here in terms of mental health, in terms of that looks at what type of light do we maybe want. And so natural daylight, there's certain fluorescence and other light that can kind of simulate a natural daylight, and those are certainly positive, as well as, of course, just access to natural light. And light produces kind of a direct arousing effect, as I mentioned. It activates the neurons in the brain for alertness and arousal, which is certainly a benefit for if you're at work, and also can impact the circadian rhythms. Important here that circadian rhythms also very well linked academically and clinically to mental health outcomes. And so as we adjust light and what it does to circadian rhythms, that's going to be probably important. And so we did some initial surveys here, and it's a part of a larger survey that we still have ongoing. And so one of the things we recognized early on is, we do a lot of surveys in the built environment, and there was no survey that we knew of that was associated with mental health. And so we thought, well, we want to change that. And so it's actually not easy to create your own survey and make sure that it's capturing what you want it to capture. And I'll talk about that example, or an example of that later. But we thought, well, how can we look through this? And one of the things we looked at was lighting in our survey. And we said, here is showing you p-values of how the occupants in their residences rated their natural light versus general health, emotional well-being, or social function. And so in our studies, when we work with veterans especially, a lot of times we will have them come into the office, and they fill out these surveys, and they talk with individuals, or they take stress tests, and we get lots of information, which is really and we're extremely beneficial working with the Veteran Affairs. I've found we also have a historical record of where they've been and where they're going, and then we also have access to all their electronic medical records, so we can get a wide amount of information. But if we want to just take a snapshot here, which is like this home survey, we found that that in general they're close to significant, but they were not significant for our active duty population. And so again, it's only one of the survey questions. We're still going through a lot of the survey. We have over 500 respondents now on the survey, both active duty and veterans. But here, in terms of lighting, suggested, I think we have to realize that there's a trade-off to reduce natural light. So as we going to more energy efficient systems and reduce the amount of openings maybe in the walls or in the ceilings, there's certain negative connotation that happens as we reduce our energy consumption, or if we do it for that reason. We also have we think it's important, I'm going to talk about next, is personal control of your light. And so having the individuals that have some control is quite beneficial for them. And lastly, we look at this, we think that daylighting fluorescent bulbs, or these kind of newer bulbs that have come out in the last decade or so, really have some promise, and hopefully also helps us with energy. So as we've in the Department of Defense and other places have switched over to more energy efficient bulbs, we maybe have not captured what that does to people's either productivity or their mental health, and this factor should be included. If we look across for the veterans, we saw actually even less significance, probably because we hypothesize that all of our veterans are actually living in Denver. And so when we compare active duty population in Ohio, which already has much less natural light than Denver, if you had the opportunity to live there. So we have more work that we're doing here. Another poll question. So asking you about if we think about personal control, so what can you control in your office, right? Assuming that you're in an office, and if you're sitting at home like I am, kind of remember back to when you did work in an office, what does that compare to how much control you have at home? So is it 10%? Is it 50%? Do you get basically you have half the control in the office as you do at home? Is it about the same, or do you actually have more control in your office, office environment than you have at home? So appreciate getting feedback there as we talk through personal control. And so this was also part of the survey results, where we wanted to look at what happens when people have personal control of their office environments or their residence environments. In this case, we were looking at residents, and we know that as people take more ownership of their areas, they generally are happier with their areas, right? And so when you go into somebody's home and they have pictures of their family up, or they have pictures of places they've been, right? That generally means that they feel more comfortable there, right? And some people in the military will say, well, a house is not a home until we put up our pictures, right? And we have boxes everywhere. It's okay, we can live with boxes, but once we put the pictures on the wall, then we're in a home. And so we wanted to look at that. And we specifically, though, we're looking at nature pictures. And so this goes back to, if you heard the Biophilia Hypothesis, that humans, and this came out about 2 or 3 decades ago, mid-70s, that humans have a natural affinity to nature. That we can go outside, we can look, and things that are living we are associated with. And that's been extended beyond just actually going out to nature. It's actually been extended to pictures of nature. And so out of all the things we looked at from this survey, over 30 questions, individuals, and this is veterans, that had mental health problems, negative mental health outcomes, if they didn't have nature pictures or pictures of nature in their house, they were most associated with these different mental health disorders like severe depression, interpersonal relationships, insomnia, and PTSD. And we've since kind of went back and trying to think through, well, what does that mean? Should we just buy everybody Ansel Adams and everybody's going to be happier? But I think it actually ties to more of the personal control that those individuals, maybe they're not in a stable house, or they don't feel comfortable putting things up in their house, and so that's probably more in line to what we're seeing. We have a follow-up survey that's working through that. And so there's lots of things that we can look at in terms of personal control. Here, I give you an example of temperature, and so somebody did an affect temperature on performance, right? And so we can look at these studies and say, okay, well, then should we all be operating in an office? In this case, it's about 22 degrees Celsius, I think, which is 72, 73 degrees Fahrenheit. So should we just set every office thermostat to that number and we'd be most productive? Right? And there's probably a good chance that that's not the case, right? So you might operate perfectly at 72. You might operate much better at 78. You might actually operate better at 72 in the afternoon when you're a little sleepy and 78 in the morning. And so how do we create buildings in our built environment with more of this personal control? And I'm using here in this case performance, which is far more studied than mental health, but I think it also could be very related to mental health, right? So if you're not satisfied with your environment that you're in, that's a stressor. And so this could be other things. Airflow, we've all been probably in buildings where you're sitting right under the vent, or you're in buildings where there's no vent near you. Could be relative humidity, lighting, access to natural light, very big one now with all the cubicles that we have. Could be smells, could be furniture layout. Some people, they go to the office, they can't change anything, right? And so that frustrates people. So in this one, this is really a hard one to fix, this personal control, and I think it's going to take quite a fundamental shift to get there. So you can look at how do we have occupants to be able to change control, and again, this is usually kind of a fight against energy, and so we can think about this in terms of how do we have control, and then can we use portable systems? And there's a lot that are out there, whether that's as simple as a little fan that can come on that you can turn on whenever you want, to much more sophisticated building integrated systems. So as mentioned, I'm a microbiome researcher a lot of the time, so I didn't, but I won't harp here too much. Again, we look at chronic inflammation associated with many things. In this case, the figure is showing you cortisol. So we measure cortisol from saliva, which is an indicator of stress. And then we look at how that relates to a diversity of the microbiome, in this case, the bacteria in somebody's gut. And so we do some research on that. Again, I won't touch here too much. We also do some research in dust. What we don't do research in is right now you can go out and buy what they're calling a probiotic and just spray around to your house. Don't necessarily recommend that. But what I would like at some point is to actually be able to go through, if I can find the microbial constituents that are associated with stress, and we do know some of them, or other mental health disorders. And what I really would like at some point to be able to tell a commander, like, instead of going out and doing a survey of their unit or anything, like, could I just swab a desk or a bunch of desks, or can I just take an HVAC filter, look at the microbes that are there present in that built environment, and give them some indication, give everybody some indication about stress levels. And so maybe if I get post Air Force research funding here, I'll work on that kind of stuff. And I think this is the last poll question we have for today, as we kind of getting towards wrapping up. I'll try to wrap up quickly. And how far are you living from a green space was the question here. So you can be a quarter, half, how far are you from that green space? And out of all of the mental health study built environment, granted it's a little bit of stretch, not quite in the built environment, but the green space is most fairly researched, right? So how close are we to a park? And we've thought about that kind of. I think initially a lot of people were thinking in terms of miles, these major parks. Now there's a lot of people that have done research and find that smaller parks are beneficial, even in the even quite small, like even lot size, are beneficial. And has some intrinsic qualities of the green space. There's some benefit for air quality as you go there. There's some benefit in terms of healthier lifestyle and physical activity, and also provides an area for social interactions. Shown here in this study, in the vertical, it looked at, there was a really interesting one. This is showing you relative risk, which again is anything over 1 is probably a negative here. And it's a chance for developing a mental outcome if you didn't have access to a green space as a child. And so if you look through there, for example, I just pick one out, eating disorders is about 1.2 or about 20% chance higher to have an eating disorder if you didn't live near a green space when you grew up, or when people grow up. So interesting study. This one is fascinating because it also adjusted for a bunch of different things, including social economic status and income and other things. So interesting study. So I think here, in terms of what we could do, right? Access to green spaces would be wonderful. Quality does improve mental health. So you can't just have a half-cut grass over in the corner. It's not going to help too much. So that's important. And then lastly, I'm just going to touch on social economic status. In this, I just want to recognize that that all of these, the participants that I have in my studies, and the people that you work with, and the people that we think about, they're not all going home to the same thing, right? The same environment. And so as we think through this, and this is probably the most studied mental health structure, what's the income, what's the education, and what's their occupation. But in terms of the built environment, we look at housing quality, for example, is certainly seems to have quite a large impact on mental health. Especially when you look at urban settings, low-income housing with women can have experienced housing disarray, housing instability, which has been shown to have increased risk in depression and anxiety. Poor housing quality can also lead to other effects like mental or like infection or like pests. And so there was kind of an interesting study that looked at cockroach infestations, right? And so you would probably not be surprised to know that that the odds of depression for those that have cockroach infestation was quite a bit higher, and actually 3 times higher. If you have both cockroach and mice, your chance of depression increased 5-fold. And so that's, you know, housing quality. We also think about noise. We think generally like about airports or other large structures, but really more of these temporary noise structures actually can be worse. And so construction activities or other things. And then finally, we look at in terms of these urban environments. And some people can look at that figure on the right and think that's absolutely beautiful. And some people will look at that figure and just kind of come up with an idea of hopelessness. It's just too grand for them. And so if you're one way or the other, one thing I'll say is, next time you walk out of like a hotel room, just look down the hallway and you'll kind of know what you feel. Are you feeling a sense of hopelessness? Like, wow, there's just like a whole bunch of rooms here and this is pretty plain. Or are you okay with that? And there's a number of people that will get to that hopelessness, which is from our, in the Department of Defense, like if you walk out of a dorm room, for one of our young airmen or young soldiers, that's essentially what you see. It's just this large, expansive corridor. So I always end my studies, or always end my talks with mental health with this, and just dogs. I also do research with animals and how service animals can help mental health. But I recognize that this can be a very hard subject. And so if you're having any difficulty right now, I'd encourage you to reach out to someone. At the very least, you can go onto this website and where you can get a live feed, actually 6 different live feeds of puppies, which always makes me smile. And with that, I went a little longer than I was hoping, but I would happy to take questions. So I'll turn it over to Lieutenant Colonel Hammer if you want to start off or orientate our questions. Thank you.
All right. Thank you so much, Lieutenant Colonel Hoysington. What a great topic. I'm trying to get my video back on. Okay, there it is. So I am in the chat looking for questions. If anyone has any questions, please feel free to ask at this time. Lieutenant Colonel Hoysington, this was such a great and such a relevant topic for us today. You really bring another dimension of health into the health engineering task force, soon to be community of interest, and SAME in general. I am really glad that this is being recorded for the folks who couldn't attend today. I would like everyone to spread the word, come back over to the Health Engineering Task Force website and listen to this message. I think it was really relevant. Again, I live between 2 train tracks, and now I work from home because of COVID, and it does get a little nuisance or annoying, and now I have some maintainers outside cutting grass. So it does affect somewhat my own distractions while trying to work and all of those things. So hopefully you can't hear the grass being cut out there. So let's see, we have one question, and it is a comment. You speak of cats and dogs and candles as being detrimental to the living condition. Can they also be a positive impact?
Sure. Happy to take that. I don't think I mentioned dogs. I am a dog lover, so maybe I might have slipped in the cats, so I apologize for that. But in terms of, let's talk about in general, right? So aromatics can be very positive, right? And so I'll talk about candles first, I guess. Aromatics can be very positive. You just got to be careful, right? So they also can be quite large. The worst is probably burning incense. But also, like if you're spraying Febreze on a daily basis, that also probably is not so good in terms of your particulate matter. But you'd have to make that determination kind of as you go, and whether or not you know what the benefit outweighs the negative. In terms of cats and dogs, I would say I absolutely would think that they are more beneficial than negative most times. If we look at microbiome research, there's a lot of benefits of dogs in terms of spreading microbiomes. And so dogs that go out, they go outdoors, they come back. There's a lot of research that on the benefits in terms of mental health for both animals And having animals there, especially having animals as you're related to, as you have younger children, in that 0 to 2, as they develop their immune response that they'll have for the rest of their lives. So definitely some very big benefits. So if I came across saying that you shouldn't have any of those 3 things, I apologize. I certainly would be mistaken with that.
Okay, great. Thank you so much for that question. Does anyone else have any other questions or comments? We'll take comments too. Okay, so, while you're thinking about any questions, oh, go ahead.
Yeah, so I apologize. I'm just getting to the poll questions, and so I would say for those that think they have 10%, right, and so that was most of our participants here thought they had 10% or less of control in their office than they do in their home. So I think for those, like, you know, if you really, and you can do your own research whether or not you think personal control is important for mental health, but if you do, then how do we, wherever you're at, whether you're a supervisor or designing buildings, how do we alter that? How do we change that number so we do have more control in our built environment? And it's certainly not easy. I sit here at Tyndall. We're doing $2.8 billion after Michael for reconstruction. And when I talk about, you know, hey, can we change something like can we have individual lighting for people? And you know, the standard response is, well, no, it's not in the UFC. And so I'd encourage you, you know, if you saw it or heard any of this that was kind of you thought was impactful, you know, the next step is how do we make changes? Sorry, let's go back. What's your question?
No, that's good. I have another question. I live in the city, but love open windows. How do I deal with air quality?
Good question. Well, I think, you know, if you look at air quality, depending on where you're at in the city, and I would stress that certain times would be better times to open the windows than not. And so if you look at particulate levels or something like that, if you're in rush hour, if you're close to that, to a driving area, or if you're close to again, it'd be driving for ozone, then you probably would want to have your windows closed during those times of the day. Other times you could open them up. So certainly in the evening or whenever. So you got to kind of be a little, or where I'm at, I'm a little bit more careful about when I open my windows, but I also enjoy just having the outdoor air. And I think there's a huge benefit of that. You can do more drastic measures. There's been some research, like in terms of particulates, developing your own kind of fan system, attaching a MERV onto a fan, which actually has some benefit if you still need to have windows open if you're in an extreme event like a wildfire, situation. But generally, I would just kind of pay attention. And there's a lot of, even if you're not familiar with air quality standards, right? There's AQI. Has and you can look on the Weather Channel or any other app now, and it tells you, oh, it's a high allergen day or high allergen right now, and so you can adjust your behavior based on those numbers, even without knowing kind of what those numbers really mean.
Okay, we have 2 more minutes to go, and I do have one more question for you. In the federal government, there is a push to 150 square feet per person. Is there an optimal cubicle size backed up by the research?
No. So I wish that I could say that that there was something where they said that individuals need this amount of space, but I can't say whether it's the 100 standard, 150, or 200 to actually have that specific space. I would stress, I think that research would say less on the size and more on other factors. And so like access to natural light or ability to control the area or ability to control your noise levels is probably much more important than whether or not we're at 100, 125, or 150 square feet per person.
Okay, excellent. Well, thank you all again for joining us this afternoon. We are the Health Engineering Task Force. We do meet on the 3rd Thursday of the month at 12 Eastern Time. So please go ahead and visit our website at the SAME Community of Interest link. You will find us there. You will find our meeting events. Our next meeting is in September, the third Thursday. We will be having a working meeting, and we're going to take a look at our steering committee and try to get some volunteers to join us there. So please feel free to join us. You can call me at any time. I am Elisa Hammer. You'll find my contact information at the website. So once again, thank you, Lieutenant Colonel Hoysington, Dr. Hoysington. Thank you so very much for your expertise and sharing this with the Health Engineering Task Force and Society of American Military Engineers.
Sure. Can I add one more thing?
I want to. Absolutely. Please
Sorry.
do.
So hopefully it came across, but this is something very passionate of mine that I work on. So if you have any other questions or want to talk more, you know, when Lieutenant Colonel Hammer asked me if I would present on this, I said, yes, I would love to. So I love talking about this, and I would make time for anybody if they had questions or comments or just wanted to talk about it. Thanks.
Awesome. Thank you. Thanks again, all.